On this Friday night, calls to further cut contacts in Canada.
I know that it's hard, but it is temporary.
What it could mean for Christmas, plus the hospitals reaching the breaking point. Also tonight, we are in Washington, D.C. for the countdown to the presidential election. The frenzied final days of campaigning and what the astonishing numbers of early voters could mean. Helping heal our neighbors.
It was the right place to be at that time.
The Canadian healthcare workers choosing to stay in the U.S. And thinking outside the box. Canvassing for poppies in unprecedented times.
Global National with Donna Friesen.
Good evening and thanks for joining us. We are in Washington, D.C. as America counts down to the presidential election on November 3rd. Canadians don't have a vote, but we certainly have a lot of interest in what America decides. Both candidates are on a final big push for votes. President Trump is holding more than a dozen rallies between now and Monday evening. We will get to that in just a moment, but we begin tonight in Canada because the coronavirus is spreading in Manitoba and other parts of the country at an alarming rate. And there is new national modeling out on where things could be headed. The new projections show how we could slow the spread if we reduce our contacts with other people by 25%. The curve should bend back down. But if nothing changes in the way we behave, the projection shows the curve climbing steeply. Canada could hit 8,000 cases a day by mid-December. And if we increase our contacts, we could hit that mark by November.
In communities where the cases are rising quickly, we need to keep our contacts as limited as possible. So when you're thinking of seeing people outside your household, ask yourself, is this absolutely necessary?
Here are the case numbers today. Quebec recorded more than 950 positive tests and 17 deaths. There were nearly 900 cases in Ontario and 9 deaths there. In BC, 272 new cases. Alberta set a new record, 622. Manitoba also set a record, 480 cases. We will take you to Winnipeg, which is moving to code red in just a moment. But first, Abigail Bimman on the big picture and what it could mean for the weeks and months ahead.
On the day before a different-looking Halloween, the country's top doctor is already setting expectations low for Christmas.
But we do have to celebrate them differently, all the way to Christmas and probably beyond. We're working really hard on vaccines and new treatments. But until then, big parties are off.
Keep your contact groups small. Stick to those in your household as much as possible. That's the message again as officials released new modeling.
We have to continue to engage in these behaviors, even as it becomes frustrating.
COVID-19 cases keep climbing, and so do deaths. Now an average of 30 Canadians are dying each day.
While we have consistently observed the highest incidence of COVID-19 among young adults aged 20 to 39 years, we're now seeing a concerning rise in the incidence among individuals 80 years of age and older, which is the age group at highest risk.
Theresa Tam says more needs to be done to stop outbreaks in long-term care. But the pattern of outbreaks is shifting, with many more now linked to private social gatherings than in the spring: weddings, funerals, community events.
Some of these events are considered super spreader events, with large numbers of contacts involved. These put significant strain on public health capacity to interrupt transmission.
You can see here hospitalizations are also on the rise. An average of 1,100 people are treated each day, but that's far less than the spring peak of 3,000. Dr. Tam says that's in part due to better treatment options and the younger age of patients, but warns, like everything else in this pandemic, things could change. Abigail Bimman, Global News, Ottawa.
The spike in cases in Manitoba means Winnipeg will move to code red on Monday. All other areas will be elevated to orange in the province's pandemic response plan, and new restrictions will be in place for a minimum of 2 weeks. Test positivity rates have hit new highs, 8.6% across Manitoba and 9.7% in Winnipeg. Brittany Greenslade is reporting from Winnipeg tonight.
The intensive care unit beds in Winnipeg are filling up. The system is being overwhelmed, and capacity is a major issue.
I would argue that that breaking point was probably within the last 24 hours, and everybody should be very concerned at this point in time.
One Winnipeg hospital doctor, who Global News has agreed not to identify for fear of repercussion, has seen the first-hand effects of COVID-19 and the struggle it's placing on our healthcare system. He says they are right on the edge of making life and death decisions.
Having to choose between patient A and patient B because patient A is 5 years younger and has 1 or 2 less health problems, that's not fair.
The province says while there is some capacity, we are at a critical point.
We are not there yet, and I think we need to do everything within our power to do it. So I'm not ready really to have that conversation. I think we still need to fight this fight.
Extra capacity is being added immediately, with the province gearing up overflow space and redeploying staff where possible.
I'm hoping that we can turn this around now. We're obviously getting close. I said on Monday that this was going to be the challenge of our lifetime.
One they say is going to take an effort from everyone. Brittany Greenslade, Global News, Winnipeg.
Now to the U.S. Just 4 days until a presidential election, and a record high number of Americans have already made their choice. More than 85 million Americans have voted early in person or mailed in their ballots. In Texas, more than 9 million people have voted, and that is more than the state's total turnout in 2016. In the final days of the campaign, Democratic candidate Joe Biden and Republican candidate Donald Trump are scrambling to motivate and energize those who have yet to cast a ballot.
Have a tremendous victory. It's going to be a victory like none other. It's the most important election of our lives.
There's nothing beyond our capacity. So honk if you want America to lead again.
Our Washington Bureau Chief Jackson Proskow is with me. Jackson, this final push for votes is something else.
It really is, Donna, and welcome to Washington. This final push is all about locking this up for either candidate because right now, both of them have potential paths to winning the presidency. I want to show you a map that gives you a sense of this final campaign push here. The states that one or both of the candidates will be in over the next few days, those northern Rust Belt states, if they look familiar, it's because those are the ones that Donald Trump won in a squeaker last time around. Now he's polling even or slightly behind Joe Biden, so he's really on the defense there. And then when you look at southern states like Florida, North Carolina, and Georgia, Trump won them handily last time. This time around, they're in play. So Trump is really on the defense in old and new territory this time around. His strategy to try and lock this up in the remaining days has him holding 14 rallies between now and Election Day. For Joe Biden, the strategy is really about focusing on Pennsylvania because that is one state the Biden camp believes that they could lock up early and deliver a decisive result on election night.
Jackson, the early voting numbers are astonishing. What could that record turnout be a sign of?
It's a sign of a few things. One is nervousness about how Election Day itself will unfold in the middle of this raging pandemic and with fears of potential violence at the polls. And to give you a sense of how astonishing this is, you mentioned those numbers in Texas. More than 100% of 2016 turnout is already there. Other states like North Carolina are in the 80 to 90% range. This is right across the board. It's really, really remarkable stuff. The other thing to keep in mind here, though, is that people may be trying to read into these early voting results, figure out what they mean. We don't know right now because we don't know who these people are voting for. What we do know is that it could mean for a long and potentially very interesting election night because they'll pre-count some of those mail-in results, but then results could shift to a different candidate as the in-person votes are tallied up.
Yeah, it's going to be a long night, couple of days, possibly weeks. Jackson Proskow, thanks. Here in the U.S., hospitals in many states are becoming overwhelmed. 21 states are reporting record daily case numbers of COVID-19, and up to 1,000 Americans a day are dying. In hospitals near the U.S. border, among those treating American patients are Canadian healthcare workers. Our Jeff Semple is in Michigan, and he spoke to some of them.
So my name is Nikki Hillis-Walters. I'm a nurse. I'm Canadian living in the U.S. right now.
Before the pandemic, Hillis-Walters was living in Canada, working 2 jobs, in Windsor and another at a hospital near Detroit. But when COVID-19 hit, she was forced to pick a side. So she went where the need was greatest.
We were getting slammed with tons of admissions with this virus that no one had really heard of much before. It just really felt like it was the right place to be at that time.
Steve Homick, registered nurse.
Okay, where are you from?
Windsor, Ontario.
Homick is one of 1,600 health workers who live in Windsor but commute cross-border to Michigan.
Obviously have friends in the hospitals in Windsor. It was quite different hearing their stories where there was only a few people in their ICUs at one point, as opposed to ours where we had to literally create a new ICU to house all these patients because it was so out of control. Like two different worlds, really.
And another difference, many of their American patients can't afford to get sick.
They were trying to beat it on their own or trying to just to avoid the cost that it would be to treat it, right? So by the time they were coming in, it was like almost too late, right? Because it's like now they're too far gone.
Hi, I'm Wendy Brothers Peterson. I am a Canadian. I am a RN case manager for hospice for a large rural area of Montana.
Brothers Peterson says in her care facilities, she's often the only one wearing a mask.
The majority of the families give me a look. There are comments about masks with the rhetoric that unfortunately the president of this country has made normal. It's hard not to be angry.
But there have also been moments of hope. At the height of the first wave, Hillis Walters looked out the window to see this.
People in this community did a parade around the hospital. They honked and they drove through and they had signs, and local restaurants were sending food. It's an opportunity to come together. And I think that starts with, not seeing myself as like a Canadian necessarily, an American, or just like a nurse helping a human.
A number of those cross-border Canadian healthcare workers told us that at the beginning of the pandemic, they were offered the opportunity to remain in Canada, to ride out the pandemic north of the border. But all of them said the same thing: not a chance. Donna?
So much work to do. Jeff Semple, thank you. Well, back in 2016, Donald Trump lost Minnesota by about 45,000 votes. This time, he's hoping his tough record on immigration might make the difference. Heather Urix West is in Minnesota tonight.
St. Cloud, Minnesota is a quiet community about an hour's drive from the Twin Cities. Less than 70,000 people call it home. But within the last decade, a growing number of residents have moved here from other countries.
A surge of refugees, specifically from Somalia.
Families of new immigrants, mostly refugees, were attracted by jobs at nearby meat processing plants. But adjusting to the sudden influx of new faces, more than 1,500 people in just a few years, was difficult for some who felt the community was changing too fast. Much of Donald Trump's campaigning in Minnesota has focused on this issue. At rallies in the state, he's called Somali refugees criminals and terrorists.
And what does Biden now propose while the pandemic still smolders around the globe? Increasing refugees by 700% from the most unstable, vulnerable, dangerous parts of the world.
21-year-old Ikram Amolji came to St. Cloud as a refugee 6 years ago. She now teaches high school and says members of her community are tired of feeling attacked.
We have a president of this country that are coming to our communities and specifically targeted us.
The problem perhaps with that strategy is refugees are not illegal immigrants. Many have gone on to become U.S. citizens, and in this election, they can vote.
Our community are so excited to vote out Trump.
And Minnesota's Somali community isn't alone. Greg King works with many in the state who have come from Southeast Asia.
We're talking about, 5 to 7% of the electorate here in Minnesota. So it's definitely more than enough to swing an election.
Immigrants who've grown tired of being targeted, eager to use their vote to fight back. Heather Urix West, Global News, St. Cloud, Minnesota.
A new twist on a popular fundraiser coming up, how this year's Poppy campaign is getting a reboot. The Poppy campaign is one of the best-known fundraising campaigns in Canada. It happens every year in the lead-up to Remembrance Day. But as Mike Couture reports, like everything else in 2020, the Royal Canadian Legion has had to adapt.
Did you want a poppy, dear? Do you want to wash your hands?
It's the traditional Poppy campaign with pandemic provisions.
I love this.
Plexiglass protects Doreen Rock and Beverly Ann Kelford, who for the first time in decades can't physically pin poppies on people.
I'm a person, I like to give a hug, I like to pin on the puppies, but we have to follow the rules, and that's the way it is.
Those health considerations mean many locations across the country will have just a poppy box with no volunteer or veteran. The Royal Canadian Legion hopes that won't mean fewer donations.
Canadians are extremely generous, and I really think that they are going to understand that we are in unprecedented times here.
The goal is to match the approximately $20 million raised last year. All of that money goes towards veteran services, and they hope this will help. The Pay Tribute Tap Box automatically deducts a $2 donation when you use a tap-enabled device or card. It was already being developed with HSBC long before the pandemic hit, but it now feels fortuitous.
Most of us don't have cash in our pockets anymore, and there's now the COVID situation where folks don't want to touch things.
The pilot project will be in limited locations across the country. Something else that's limited? These Legion masks. Originally given to veterans in long-term care facilities, they're also being sold on the Legion's website, with proceeds going to help local Legion branches.
Thank you for doing this.
Beverly Ann and Doreen are getting used to working with the gloves, masks, and hand sanitizer. COVID-19 or not, they're determined to be here so that no one forgets those who paid the ultimate sacrifice for our country. Mike Lecouteur, Global News, Ottawa.
What's at stake for Canadians in the U.S. election? Ahead, I put that question to Canada's ambassador to the U.S. Tonight, Global National is broadcasting from Washington, D.C. We're back in a moment. Welcome back. Canada's ambassador to the United States is Kirsten Hillman. She got the job in March, but before that, she was deputy ambassador and played a key role in trade negotiations, so she knows the U.S. well. She's a diplomat and so isn't picking sides in this election, but she does acknowledge there is a great deal at stake. I spoke to her earlier and started by asking how the last 4 years have tested the relationship between Canada and the U.S.
The last 4 years have, as Canadians know, seen us renegotiate the NAFTA with the U.S. administration, and that was a process that wasn't always easy. It had its ups and downs and its challenging moments, but the benefit of those discussions was that it allowed us to really build a lot of strong relationships with this administration, the Trump administration, and many of our colleagues in the Senate and in the House on the Hill. And I think that, it's those relationships that have helped us a lot in recent months as we've been trying to manage some of the challenges of COVID together. So like any really deep and profound relationship, there are tests from time to time. But when you have strong relationships, right from the leaders on down to the officials that are dealing with each other every single day, then, we can get through a lot of things together. And the past few months have shown that they're very effective relationships that we have in place.
Well, yeah, and right now there is a lot to get through. The border is closed. There's no end in sight to the pandemic. Canada and the U.S. are both in recession. Where do you see a bright spot, if you see one, in that picture?
Well, the bright spot I see is that the cooperation that we've been able to have with the U.S. government and U.S. stakeholders and governors over the course of the pandemic. I think you mentioned the border restrictions on non-essential travel. I think that's a really good example because we were able to come to a decision back in March on restricting non-essential travel between Canada and the U.S. And just to put that in context, our border has, on average, in a normal times, 400,000 crossings every single day. It's the busiest land border in the world. And if you think about the magnitude of the decision, the fact we could do it so quickly is a real testament to our cooperation, collaboration, and our understanding that we really are partners that need each other in many, many ways.
Canadians are watching this election very closely. There's concern about how partisan and divided the U.S. is right now. What would you say to Canadians, and what will you be watching for on Tuesday night?
We are all watching the U.S. election. Canadians are watching it. Americans are watching it. The world is watching it. And that's a testament to the role that they play in our world. So we will watch, and we will have confidence in the Americans to choose their leadership and move on and continue to play a very, very important role in our society, in our world.
Ambassador Hillman, thank you so much for taking the time.
Thank you so much.
And you can see the full interview with the ambassador on our website, globalnews.ca/globalnational. We are in Washington, D.C. as America enters the final stretch of the presidential campaign. We're back in a moment.
You're watching Global National.
Welcome back to Washington. There is a lot going on this year, and it can feel tumultuous and stressful. We all need a way to take a break from it all, to sort of soothe our souls. And so we've asked a man named Stuart Reynolds to help us out. You've probably heard of him. He goes by the name Brittlestar, and his takes on what's happening in the news have gone viral on both sides of the border. Tonight, he has a message for our neighbors.
Hi, America. Canada here. And if you're American and watching this, it means you're one of the over 600,000 Americans who live in Canada. Or you're watching online from America, pretending you live in Canada. We know you've got this election coming up, and I know it seems like a big deal. And that's probably because it is. But don't worry. We'll be here for you no matter what happens. It's like when a good friend is in a relationship. It's not really our place to criticize the other person. But after a few drinks, we probably will. But know this, America, no matter what happens this election, if you decide to stay in the relationship or you decide to end it and start seeing someone sane, new, we'll be here for you, like a good friend, with a tub of ice cream and a couple of spoons, maybe some maple syrup, and probably beer. Don't bring beer. We're going to need Canadian beer.
Only the good stuff. And that is Global National for this Friday from Washington. I'm Donna Friesen. Tomorrow, we're bringing back our program called The New Reality, which premiered in the spring. I'll have a profile of Daniel Dale, the Canadian reporter whose full-time job is fact-checking President Trump. And boy, has he been busy. That and much more tomorrow on The New Reality, right here on Global. Thanks for watching. Take care of yourselves. Bye-bye.